going into dental school, I knew that I was interested in learning more about specialties, as I had already shadowed actually some periodontists and some other specialists. And when I was learning about different specialties, the first week of dental school orientation, someone mentioned orthodontics and dental facial orthopedics. And I just, as a kid playing sports, I was always interested in orthopedics. And when I went to dentistry, I kind of was looking for something that combined dentistry and some level of orthopedics, and orthodontics was the perfect mix. And I actually was one of the few students, I think, in my dental class first year to fall in love with occlusion and craniofacial function. And it just led to our orthodontic pre-doctoral course in my sophomore year. I loved it, and just kind of kept going each step of the way, enjoying each successive orthodontic experience. So then I started shadowing, and one thing led to another, and that's the direction I ended up wanting to go. What I've also learned with orthodontics is I see a wide range of ages. I love treating kids, but I didn't want to focus strictly on pediatrics. So being able to treat kids, teenagers, and adults, it's kind of the perfect mix in orthodontics, where I'm seeing kids as early as 5, 6 years old, and I'm treating patients as into their 80s now. And sometimes I have days where it's mostly kids and others where it's only adults, and it's very family practice oriented when you get that range of patients. So that's kind of what I love about orthodontics, and what I've learned going into it so far. So I use mostly Invisalign, almost exclusively Invisalign, because Invisalign's been the standard for over 2 decades. It's kind of been it was really the pioneer of clear aligner treatment, and it has an outstanding software, and it has the customer service that I need to provide the best for my patient. I trust what I'm doing when I submit a case to them, and I know where my cases are going from start to finish when I start working with the technicians, manufacture a case, deliver a case to a patient, and I feel good about what I'm getting from start to finish. And, there's a lot of other clear aligner options now. I've tried different clear aligner systems, but none have been as reliable and predictable for me as Invisalign. And I have patients who have had just great experiences with it. I just know what I'm getting, and it allows me to treat the most complex patients or some of the simplest cases. I've used Lightforce. What I found is that I like Lightforce. Not all patients want ceramic brackets. It's a great AI-based solution and very customizable for patients that want ceramic brackets. We also offer, AI-based digital treatment plan brackets with metal as well. So I can do kind of the more traditional brackets with metal, and you don't get all the benefits of the customizable nature of Lightforce, but you still get substantial benefits from planning your cases digitally, even with metal brackets and AI. So I'm using different systems like Dibs AI. I've used 3M systems with their AI-based digital treatment planning software, and the indirect bonding is a much easier process getting braces on, whether it's Lightforce or the brackets, any bracket system where you're using an indirect bonding system, especially some of the contemporary ones, I think make it much better for the patient. Again, I think I know where my cases are going. I think it's more predictable because my brackets are landing more precisely and accurately right from the get-go. So I think I get a better and more efficient result. So I am seeing with indirect bonding, whether it's Lightforce or another digital treatment planning software, great progress after as early as 6 months that I may have gotten before, but this is more consistent, and level and aligning teeth is happening substantially faster, which for patients is great. You're seeing aesthetic and functional benefits right away. Case might not be done after 6 months in all these cases, but you're often saying to patients you're going to be in treatment for 12 to 18 months, no longer 18 to 24 or more. And that's a pretty big deal, whether it's Lightforce or any of these predetermined digitally planned treatment plans. During my training, we worked a lot with MGH when I was at the Harvard Orthodontic program. So I continue to work with MGH, and They have a outstanding orthodontic team over there, and it gives me the ability to treat the most complex cases in dentistry, orthodontics, or oral surgery, working with the orthodontic team at MGH. So yeah, we do quite a bit of orthodontic cases. It's one of my favorite type of cases to do. You can do it now with braces or Invisalign. Everything fully digitally treatment planned, from the orthodontics to the oral surgery, and everything's 3D printed as far as like the titanium plates that are going in after orthodontic surgery. So our patients, the predictability of the treatment's getting significantly better than it was even then when I was doing my residency training. And I think for patients, it's becoming a much more um, efficient process, and orthodontic surgery is a better option, I think, than it was even 5, 10 years ago for a lot of patients, because even cases we might have said might have been more difficult with planning, or success rates are becoming more favorable. So yeah, we're when it's indicated, we're recommending it, and I have a ton of confidence with the teams we work with in orthodontic surgery, so that we can really achieve great results. I think what I love about AI is just the efficiency of it. So when we take radiographic images, and I can use a system or software like a DiagnoCat and generate diagnoses within 5, 10 minutes, these are processes that used to take me 3, 4 hours or more as a resident. And using AI, I'm able to generate incredible amount of information, not just orthodontic. We're looking at oral pathology, perio, all dental diagnoses. And I'm able to explain to patients at their first visit, taking the x-ray, where I want their incisors, where their molars are, where they have good bone, where they might be more limited with tooth movement. And I find that educating patients like that is invaluable. So having it in the diagnostic stage is huge. Using AI beyond that is definitely helpful. You can almost pre-manage your cases. You know where cases are going before you even start them. And I think we're getting places more predictably and efficiently by having the AI, starting with the x-rays, going to the aligners or brackets, and everything else we do. So I focus a lot on airway during my diagnosis. We get a ton of information from the 3-dimensional radiographic images. I can see a lot clinically in patients if they do have sleep issues. A lot of patients who have sleep issues don't know that an orthodontist can help with that. So a lot of patients that come to see me for orthodontic purposes don't necessarily come to me for sleep or airway issues, but we're trying to educate the population. We try to educate our patients on what we can do as orthodontists and specialists to improve that area. A lot of the times, to get the results that patients need with sleep and airway, oftentimes orthodontic surgery is indicated. Different types of expansion, bimaxillary advancement, anything to increase airway size and volume is pretty critical. Other times we're working on 7 to 10-year-old patients doing phase 1 treatment. So anytime I have young patients in here, we're absolutely looking at airway, looking at ways to enhance the airway through expansion, and a lot of times mandibular advancement. We've done a lot of research on MARPE surgery. I've taken substantial coursework on MARPE techniques and procedures over the last couple of years. I think it's the direction orthodontics and oral surgery and perio are intertwined and working together to solve some of these transverse issues in patients, airway issues, sleep issues. We are implementing it more into our practice. It is not like our specialty yet, but I do think that there's a bright future for MARPE treatment. I think there's still some things that need to be solved to make it as predictable and get the favorable outcomes that patients need. But MARPEs are an interesting treatment option for patients that might not need orthodontic surgery. It can all be done in the practice, so we avoid going to the hospital to have full surgically assisted rapid palatal expansion. So I think it's a good treatment option, but sometimes still orthodontic surgery is indicated. It's simple. One of the best things that we have here is we don't have to take the old alginate impressions anymore. No more goopy impressions. We use an iTero scanner, the highest standard of care for a scanner. So we're able to get a 3D model of their teeth, send it to a lab, and have it made pretty quickly. Within a week or two, they can get a customized mouth guard, any color design they want.